Joining me right now is Dr. Zaher Sahloul. He's the president of MedGlobal, a humanitarian organization focused on emergency response and health programs. They have a team of doctors in Gaza right now.
Citizens bring in mass casualties. There often are rushes of 20, 30, 40 people brought into the emergency room at one time being dealt with on the floor. There's absolutely no room in the hospital whatsoever. There's patients on the floor, on the stairs, everywhere. It's a catastrophe. It isn't collapsing, it is virtually collapsed.
This hospital is not functioning, but there's pandemonium. It's total chaos. These patients, many of whom are either amputees or they have been injured or they're even just sick from some sort of bacterial infection. They're not able to move around, and there is no staff to check on them or to give them the antibiotics that they need or to deliver the care. And so there is a true level of uncertainty taking place here. They are all at risk.
I've been in Gaza 4 times before, and Gaza has a reasonable healthcare system despite of the blockade over the years. And their doctors and nurses are very capable, and they're up to date on medical knowledge. They need support, and now they have this huge influx of injured patients. Besides that, they had the bombing. More than 76 health centers were attacked. Several physicians and nurses were killed in the attacks, and ambulance.
The situation has only gotten worse since you were there. The Gaza Health Ministry now has placed the child death toll at least 12,300, with thousands more still missing.
We've come out of Aleppo. We worked in Haiti after the earthquake. We work in Yemen. We work in Sudan. And this is by far the worst situation I've ever seen. This is a soul-crushing event, and I've been through many of these, but this is by far the worst I've ever seen.
When we were there were mass casualty events happening each night with bombings, and there were several children that were brought in dead on arrival.
People are asking, what can we do to help the Palestinian people in Gaza during the war and after the war? And there's a lot of things that you can do. You can support organizations like MedGlobal by donating to our medical programs. You can volunteer in our medical missions. We are planning to send medical teams based on the priorities and the specialties that are requested here every 2 weeks.